Healthcare in the U.S. is really sick care, where we spend a fortune to treat conditions that have often spun out of control. A value-based accountable care system focuses upstream on primary care and prevention. But can we really transform the system? Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Dr. Mohamed Diab, president, CVS Accountable Care, and senior vice president, CVS Health. Welcome, Mohamed.
Thank you, David. Thank you for having me.
My first question is, what are the main opportunities and challenges in accountable care?
So we have a lot of opportunities, and I always like to start with the positives. So we have, we as a society and as a nation, we spend almost 20% of our national GDP on healthcare system, but we don't have, the outcome to show for it. And that's because we have a lot of inefficiency in the system and a lot of waste. So there's a lot of opportunities to reduce this waste and use our healthcare dollars more efficiently. We also have a significant opportunity in understanding social determinants of health for the patient population and try to address them, because their impact on health outcomes can exceed the impact of the disease or the condition itself, right? And the biggest opportunity of all is that we can transform the healthcare and how is it being delivered from this sickness system, as you call it, or volume-driven system to a value-based care system and a health outcome system that really look at the human being holistically and not just as a transaction, and design and create a payment model that incentivize this value-based, outcome-based system, and really get the provider community to trust these models and engage into them and really deliver more accountable care for the population. On the challenges side, we definitely have a big challenge with primary care shortage in the United States, where you have 1 out of every 10 U.S. community have no primary care physicians at all. Medicare only spend 2% on primary care, and the rest of the dollar gets spent on more costly site of care. And we definitely need more quarterback of care in the primary care settings that really manage chronic conditions and manage patients holistically and understand all what's going on in their lives, that can impact their health. Right. On the challenges side also is, we definitely have lots of opportunity in improving the quality of care for the population. There is, a lot of opportunity there, and also sharing the data, because the provider community have multiple electronic health records that is not talking to each other, and that creates fragmentation in the system, where a patient shows up in an emergency room or in a hospital or in front of a physician where he or she doesn't have access to all the information that can help them with their decision making.
What is the role of technology in accountable care?
So technology is very critical. Having, it always starts with analytics. To be able to understand the population and get as much information and data, whether it's claim-based or clinical-based or also social determinants of health, and collecting this data and using the technology and analytics and AI to be able to stratify and segment the population and understand who's at risk, who do you need to prioritize, who you need to intervene on as a top priority, because you don't want this patient to go over the cliff. So analytics is a big component of value-based care because it helps you to look at the population and understand where the opportunities to improve the health outcome, improve the quality, and reduce the waste. Second thing is electronic health records, where you're able to push actionable insight to the provider at the point of care so they can address it when the patient is standing in front of them. Because physicians today have very limited time, and you don't want them to really log into different systems. So the more you provide them the actionable inside in front of them in the electronic health record workflow, that makes it more actionable for them and they can address it immediately. So these are the main use of the technology in value-based care.
Do you think we're ready for the next public health crisis?
The short answer is no. As long as we are not, focusing enough or investing enough in primary care, I would always tell you that we are not ready. And with this access problem and shortage problem in primary care, we definitely not ready, because if COVID taught us anything, it was that the most vulnerable population during healthcare crisis was the people who have multiple chronic conditions, have no access to care, and there is no quarterback to coordinate the care for them with the various specialty that they go through and hospitalization. So we definitely not ready, and we also do not spend enough in addressing socioeconomic barriers to care. Right? There are patient population that I see that they cannot afford transportation to go to their doctor. They cannot afford the copay for their medication. So, and there is lack of investment in social services and community program to support the population. So definitely we're not ready.
Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Mohamed about his life and career. Dr. Mohamed Diab, President, CVS Accountable Care, and Senior Vice President, CVS Health, thank you for joining me today on HealthBiz Briefs.